Hi, and welcome back to Talk of the Town. We've had a great show so far, lots of seasonal advice. We've got another seasonal bit of information for you, maybe something you're not ready to think about. It's almost flu season. We're joined today by Eric Hewitt, who is our news partner from the Medicine Shop Pharmacy in Monona. Thanks for being with us today.
Thanks again for having me.
So, silly question, maybe, maybe not, but what exactly is the flu? Let's start there.
I always start with this when I talk about the flu because I think there's a lot of people that have misconceptions of some stomach viruses that they consider the flu, the stomach flu, if you will.
Sure.
And that's really not what the flu is when we're talking about flu shots and the flu season. What we're talking about there is a respiratory infection. So in your lungs, the really nasty cough, the drainage, the fevers, the chills, that kind of thing. It's not so much a stomach flu, but we're talking about influenza, which is a chest cold.
You're bringing me back. We've all been there, right? So it is time to start thinking about that again.
Yes.
So this is the time, right,
Yes.
to start thinking about prevention and treatment too. Let's talk about that.
Yeah, so number one, best thing you can do is get a flu shot and get it every year. There are very small sections of people that can't get it, and really those people are just allergic to eggs or they've had a really bad reaction to flu shots in the past, but that is really rare. I want to definitely make sure that people know that it's very rare. So the best thing you can do is to get your flu shot. And then if you do still get the flu, or if you didn't get your flu shot and you get the flu, unfortunately you just kind of have to treat it symptomatically. There are a few products out there, but you have to start it very early in the course, and sometimes you can't differentiate between a cold and the flu, and so it's hard to start that on time, kind of a thing. So after you get it, you just kind of have to grin and bear it and
buckle up, buckle down.
Exactly.
Yeah, get through it. So try and prevent it. Let's talk about the options for flu shots.
Yeah. So there's a couple different options. Obviously, there's flu shots. That's probably by far the most popular, and you have just your regular flu shot that covers against 3 strains of the flu. You also have what they call a quadrivalent vaccine, which is becoming more popular, and that covers against a 4th strain, so one additional than compared to the other one. And then for patients over the age of 65, there's a high-dose vaccine that kind of is meant to protect them a little bit more because they're hit usually hardest. And then there is also nasal sprays and intradermal, which is just underneath the skin, kind of shots as well. So there's a bunch of different options, so always check with your healthcare provider to see which one would be best for you.
Yeah, and you mentioned some age groups that are hit harder than others. Are there age restrictions or population restrictions for different types?
Yes, absolutely. And again, I would refer you to your healthcare provider. Like I said, that high dose is for anybody over the age of 65, so if you're under 65, you would not qualify for that. In terms of coverage and things like that. Nasal spray, also you have to be a certain age to get the nasal spray. I can't remember off the top of my head what the minimum age is, but again, we can look that up for you and see which one is best if you're afraid of needles and things like that.
Now, you offer flu shots at your pharmacy. Is this something all pharmacies do?
It really depends. Most of them do now, and it's becoming more and more popular. Obviously, like we said before, prevention is the best way to treat this, and so access is a big thing. And so pharmacies really just about across the board will offer those, but there probably are some exceptions out there.
Okay, here's the big grand finale question, the one you probably get all the time.
Yes.
Does insurance cover this?
Again, this is another thing where the trend is moving in the right direction. So most of them do. There's very few insurances out there that require you still to go into your doctor's office to have an appointment to get your flu shot. Most of them has expanded those coverage to get it covered at the pharmacy. So wherever's more convenient to get it, that's where you can go get it, and it should be covered. But again, always check with us. We'd be happy to go through that with you before you get the shot.
So you can get your flu shot at the Medicine Shop Pharmacy on Monona Drive. These guys are great because they do have so much great advice. They can guide you in the right direction. Thank you, Eric, for being with us today.
Thanks again for having me.
I want to thank all of our guests for joining us. Thanks so much for watching. We'll see you here next time on Talk of the Town.